Is the United States on the verge of another public health standoff, or is this a localized incident being handled with extreme precision? Just when we thought the era of cruise ship quarantines and high-level biocontainment was behind us, a new threat has touched down on American soil, forcing the federal government to scramble. This isn't a drill, and the details coming out of the Department of Health and Human Services should have everyone paying very close attention to how our borders and our health are being managed. Before we continue, if you want to stay on top of everything happening in U.S. politics and national security, hit that subscribe button right now and leave a like. It really helps this channel grow and ensures you never miss a critical update on the stories that matter. Late Sunday night, the Department of Health and Human Services, or HHS, dropped a bombshell announcement that has sent shockwaves through the political and medical communities. An American citizen who was part of a group on a cruise ship experiencing a hantavirus outbreak has officially tested positive for the virus. But that's only the tip of the iceberg. Another individual is already showing mild symptoms, and the situation has escalated to the point where the federal government had to intervene with a specialized transport operation. We are talking about 17 Americans who were on that ship. They haven't just been sent home to self-isolate, they were flown back to the United States on a government-chartered plane and taken directly to Nebraska. Specifically, they have been moved to a high-security area that the public rarely hears about unless something has gone significantly wrong. This isn't just any hospital stay, this is a coordinated federal response to a pathogen that carries a heavy reputation for being both elusive and dangerous. To understand the gravity of this, you have to understand what hantavirus is. Typically, this is a virus found in rodents, rats, and mice, and it usually spreads to humans through contact with infected droppings or urine. In many cases, it leads to hantavirus pulmonary syndrome, a severe respiratory disease that can be fatal. The question everyone is asking right now is, how on earth does a hantavirus outbreak happen on a modern, luxury cruise ship? These ships are supposed to be the pinnacle of sanitation and leisure, yet we are seeing a government plane whisking passengers away to biocontainment units in the Midwest. The choice of Nebraska is not accidental. The University of Nebraska Medical Center in Omaha is home to the National Quarantine Unit. This is the same place that handled Ebola patients and played a massive role in the early days of the COVID-19 pandemic. When the government sends you to Omaha for quarantine, they aren't taking any chances. They are treating this as a high-consequence event. The political implications of this are massive. We are currently in an era where the public's trust in health institutions like the CDC and HHS is at an all-time low. Any perceived lack of transparency or any sign that a virus is slipping through the cracks of our travel industry becomes a flashpoint for political debate. Who is responsible for the oversight of these cruise lines? Why was the ship allowed to continue until an outbreak became this severe? These are the questions that members of Congress are likely going to be asking in the coming days. We've seen in the past how cruise ships can become floating petri dishes, and the Biden administration is under immense pressure to show that they have learned the lessons of 2020. They are trying to project an image of controlled containment, but the sight of government planes and specialized medical units suggests a level of concern that goes beyond a standard medical issue. The analysis of this situation reveals a deeper vulnerability in our national security. If a virus like hantavirus, which is not typically known for easy human-to-human transmission, can cause this much disruption, it raises serious concerns about our readiness for more contagious pathogens. The 17 Americans currently in Nebraska are being monitored around the clock. The HHS says they are taking all necessary precautions, but in the world of politics, necessary precautions is often code for we are worried about the optics if this spreads. We have to look at the economic and social fallout as well. The cruise industry is a multi-billion-dollar sector that has spent the last 3 years trying to convince the world that it is safe to return to the high seas. A hantavirus outbreak is a PR nightmare that could lead to new regulations, more oversight, and a potential clash between private industry and federal health mandates. It also puts the spotlight back on our biological surveillance capabilities. How did the virus get on the ship? Was it a failure of port security, a failure of the ship's maintenance, or something more systemic? The outcome of this situation depends entirely on the next 48 to 72 hours. If more of those 17 passengers test positive, we could see a broader lockdown of travel related to that specific cruise line or region. If the virus is contained within that specialized unit in Nebraska, the government will claim a victory for their quarantine protocols. However, the American public is skeptical. We've been told it's under control before, only to see the situation spiral. The political stakes for the HHS are incredibly high right now. They need to prove they can handle a localized outbreak without causing mass panic or infringing on civil liberties, all while ensuring the safety of the mainland. So what do you think about this? Do you trust the government's containment protocols in Nebraska, or does the sight of a government plane and specialized quarantine units make you nervous about what's really going on? Drop your opinion in the comments below. I read every single one. This situation is evolving rapidly, and as more test results come back from that group in Omaha, we will see exactly how serious this threat is. The federal government is on high alert, and the eyes of the nation are on that Nebraska facility. We will continue to monitor the statements from the HHS and NBC's reporting as this story develops. Stay informed, stay vigilant, and thank you for watching.